Well, it might not always look like it out your window, but it is spring, and that means things will bloom soon, including all of those things you are allergic to. So what can you do to make this allergy season less unpleasant? Dr. Madan Kandula is an ear, nose, and throat surgeon with Advent. Nice to have you this morning.
Nice to be here.
We just had these new flowers placed right in our table, and I could smell them already. I'll probably start sneezing
Here
eventually.
it comes. That's right.
It is that season, though, and I think, people so look forward to spring because it's like, new life, seeing things bloom, but this is really the start for a lot of people of an annual battle.
Yep, exactly. Most folks don't have these issues, but so most of us are looking forward to spring and the warmth and all that sort of stuff. But for folks who are troubled with allergy issues that especially pop up in the springtime, they're kind of dreading this change that's going to happen here in the next few weeks.
Yeah, I can almost put it on my calendar.
Yeah.
Like starting this day, I'm going to feel a lot of symptoms. I know a lot of people are like that. What's the number one complaint you hear from people who have chronic allergies?
The biggest complaint is just stuffiness. So, certainly people can have sneezing and itchy eyes and all that sort of stuff, but the thing that drives people the most crazy is a stuffy nose and just living with that during the day, and then especially at night. That's where it really gets to be, kind of old news, just drags you down.
And at night, the problem is that we're laying down, right? And so it does affect the stuffiness that we have.
Exactly. So, what's happening with allergies is your body is reacting to things in the air, and so it's trying to close your airways off.
Right.
And then when you're laying down at night, there's an additional effect of just the gravity impacting those same areas.
How do most people, when people come into your office and they're complaining about it, how do they say they fight back? Is most of the time, is it that they're taking over-the-counter medication?
Yeah, exactly. And that's, it's the good news is on the allergy medicine front, there's some good stuff out there. The bad news is there really hasn't been anything new for the last 15 years. And most of the stuff that's out there is now over-the-counter. So a lot of folks kind of dabble, I see this when I go in the drugstores, is they'll look at the shelves and kind of try to figure out what's going to help them and what's not and what's my real issue. And, and so since it's over the counter, they can kind of pick and choose. And unfortunately, sometimes they're not on the right wavelength, both as far as the medicine that they're choosing and as far as their underlying issue.
What kind of help, because that's maybe not the best way to fight back, and it's definitely not a permanent solution, especially for people who see it return year after year. What is the problem that you find with most people who have allergies?
Most people have allergies and who are trouble with that chronically stuffy nose when the allergy season hits, they have more than just allergies. So they're going after the allergy issue, but most folks have anatomy issues on the inside of the nose, either a deviated septum or big humidifiers in the nose or polyps, or there's other things in the mix that they don't know about that they're not doing anything about because medicines can't do anything with those areas. And so what they're doing, what they're trying to go after is, really all the medicines that are out there to help with a stuffy nose are allergy medicines. And if your issues are allergies, that's great and you're in good situation. But if your issues are more than that, then you're only working with just a portion of what you need.
If the problem is anatomical, how do you discover that, or how do you diagnose the problems? Because you listed like 4 or 5 different reasons.
And there's no way for you to know on your own. It's just that the hard part is no way for you to know, and there is no way, unfortunately, for most physicians who aren't ear, nose, and throat physicians to be able to tell you that. And so, even if somebody's been to their primary care doc or their allergist, whomever, and gotten things checked out and are on the medicines, that's great. But the only way to really know, as far as anatomy issues go, is looking in there with the proper tools.
And are some of those proper tools? Because I know you have the smaller scan in your office where you can look at somebody's sinuses. Is that usually a tool that you use?
It can be. So what we've got, sometimes it's as simple as looking in with my headlight into somebody's nose. We've got cameras we can look into the nose. We've got the CT scanner. So if something's happening in somebody's nose, I'm going to know about it, basically. It's not going to be a mystery. And once we can figure out what's going on, then it's more of a matter, okay, these are the things we can do about it.
Yeah, because I was going to say, once somebody's been evaluated, how can you better help people deal with, especially certain times of the year when allergies are really bad?
The good news nowadays is there's lots of different options. So there's a pretty much a step-ladder approach where we can start very, very low-key, and so a lot of times that's just the medicines. If that's not doing the trick, we can move up the ladder. There are in-office procedures that can really open up the airways. Simple, easy, feels like you went to the dentist's office and had a procedure done, where it can make a permanent difference as far as your breathing goes. Some folks need surgeries, and there's things that there are things that can be done to help the cause pretty much regardless of the situation if somebody's got these issues going on, in addition to the allergy issues.
So if somebody's watching right now and they're thinking, yeah, every year I have horrible problems with allergies, especially seasonal allergies, what's the first step they should be taking before the season starts to maybe correct this problem or eliminate it?
Really just getting evaluated. So getting it checked out, making sure that they're using the tools that are necessary to help the cause, and making sure there's nothing else that's going on that we can help maybe alleviate. A lot of times we can sort of get rid of a lot of these medicines and get people on the straight and narrow without having to deal with that on a daily basis.
Yeah, because a lot of those over-the-counter medications have side effects too that people don't like. So here's the information. If you'd like to be evaluated, especially before the allergy season starts and kicks into full gear, you can contact Advent. They are located in Wauwatosa on North Mayfair Road. The phone number to call is 414-771-6780, or you can go to advent.md. Nice to have you on the show
Nice
this
to be
morning.
here. Thank you.
Happy spring.
Yes, indeed.
Later in the show,